Welcome back to Health Daily. I'm your host, Dr. J. Today, we will talk about the top lifestyle changes needed to avoid worsening your knee pain. But first, like we always do, let's check the Google Trends and talk about what's in the news. Today, the top trending is sauna stock. So what is sauna stock, you ask? Well, sauna stock is, and let me share this here. Let me go here and look at one of these articles. Let's look at Barron's article. Sauna stock is a biotechnology company that stock popped about 200% today because they are working on a clinical trial, an in-human study on type 1 diabetes. The treatment uses transplantation to help the body produce its own insulin. So they're looking for a cure for type 1 diabetes. I think that we'll probably get a cure for type 1 diabetes within maybe 5 years or 10 years. It may shock you to hear me say that, but I'm thinking that that may be the case. So let's take a look at the chart here. This is the chart, and let's take a look at the chart for the last 5 days so we can see exactly how much this popped. So it was at $1.68, popped all the way to $6.48 today. And so that's why it's trending in the news. Where is this company? Well, I did look it up and I saw that it is, and this is a map. This shows us, I'm here in Texas right now, in Dallas, and this shows how close it is. But as you can see, it's in Sweden, and very interesting company for the rest of the world. So next, let's talk about the next trending topic here, which would be the quademic. So what is the quademic that you ask? The quademic is flu, respiratory syncytial virus, so RSV. Also, COVID-19 is not out of the woods. And also, you can add in neurovirus or anything else that would be an upper respiratory virus. But this is what people are searching for because they're having some flu symptoms, most likely cough, runny nose, sneezing. We are getting into this cold weather season. And so make sure that if you haven't gotten a vaccine that you think about it and see if that you need to. And if you are having symptoms, then go ahead and protect yourself. But nonetheless, let's talk about what we came today to talk about is those top lifestyle changes. And I will throw up this visual here and we'll talk through them. But the top lifestyle changes. So my number one change, and we'll talk about these moves here in a little bit, but let's talk about the top 5 changes. Okay, these are the top 5 lifestyle changes I would particularly do. Make sure you like, subscribe, share this video with somebody that you think may need it, or maybe family members that have knee pain that they may need this. Okay, number 1, minimize stressful activities. And stressful activities, not in a sense of exercise, not yet. We're not there yet. Stressful activities, I'm talking about food, mental stress, things that will cause inflammation in your joints, right? So we know too much sugar will cause inflammation in the body. Too much alcohol will cause inflammation in the body. Too much processed foods can cause inflammation in the body. We want to limit things that will cause inflammation surrounding our joints. And so I'm not going to give you specifics. This is not direct medical advice for you, but you can check with your primary care doctor. But this is general advice. This is what I would do if I'm trying to lessen knee pain. I had knee pain for years, but now I really don't. Decrease my sugar, decrease my alcohol use. So that's the first goal. The second one is weight management. Weight management is number 2. Think about this. And this may not be a fact, but you can say that this is maybe an estimate. For every about 50 pounds of body weight, that's about 250 pounds per square inch on each knee. So you would need to decrease that weight to be able to get more relief and decrease pain going until, as you age. Next, proper footwear, very important. Squishy shoes that are very soft and your feet are very happy may not be great for your knees. So make sure you're wearing solid supportive shoes because you can worsen your knee pain every day. And my ladies, especially if you're young, think about those high heels. Maybe they look great, maybe they don't with what you're wearing, but that could possibly produce knee pain depending on your position and how long you're wearing them. Sleep position is number 4. Sleep position. If you are a side sleeper, you may want to use a pillow in between your legs or maybe a knee pillow. That's something to consider because you can put excess strain from your hip to your knee onto your knee. And so the next day that you're kind of working from a deficit. And the last but not least is exercise. So drum roll, please. Do you think, and I'll give you a couple seconds, do you think that I'm going to say you should decrease running or increase running? I'm waiting. I think that it kind of challenges the narrative, but not necessarily increase running for everyone. But I don't think that decrease running or completely stopping running is the answer. And we know this from several studies. And so let's talk. Let's take you first to this article here by this is a Harvard Health Publishing article. So this talks about what conditions can help exercise, right? So if we have patellofemoral pain, which could be knee pain, right? So if you can't figure out what's going on with your knee, make sure you contact your doctor, your specialist, because it could be patellofemoral pain. Chronic degenerative meniscal tears, right? We have a meniscus in our knee. It's basically the shock absorber for our knee. And so you wouldn't want to ride around in a car that doesn't have a shock absorber. I'm sure you don't want to walk around without your shock absorber over your knees. So that could be also challenging in osteoarthritis. So running doesn't necessarily produce these. It could make them worse if your running style or type is not necessarily the best. If you're looking for the correct way to run, or maybe even a coach in running, consider this. If you're in Dallas, definitely contact DTX Performance. Irisima, she definitely can help you out. That's a running coach. But if you're somewhere else, contact your local gym that has a performance coach or a running coach. Definitely a running coach, because they can improve your running style and make it to where your knees don't hurt when you run. But I encourage you to do these exercises. Let's go through some of the top exercises and these visuals to see which stretches you should do. Okay, so these are top 10 stretches. I'll drop the link below. These are ones that you can do at home to help cure or improve your knee pain, right? So heel and calf stretch, as you can see by this visual and health line, this is one that you can do at home, right? Against a wall, push forward. Next is quadriceps stretch. So stretching your quads. Your quads are the muscles on the front of your leg, the top, above the knee. And so what you want to focus on, if you're focusing on knee joint pain, focus on the muscles above and focus on the muscles below. So this article is mainly stretches. We want to focus on increasing the strength of your thigh and increasing the strength of your lower leg. Strength is something that can help prevent and encourage pain to go away. So not just stretching, but strength. Let's keep scrolling here. Hamstring stretch. So lying on the ground and going through this hamstring stretch can help. These are things you can do daily. Half squat. If you can't fully squat because you complain about knee pain, you can always do a half squat or even a quarter squat. The key is this is a natural movement. This is a functional movement that you should be able to do. So if you can't do it, the goal is to be able to do it. So go from quarter squat to half squat to full squat. Next is calf raises. Like we talked about before, you're wanting to do what's below and what's above the joint. So calf raises gets your calf muscle and also a less known muscle, one of my favorite muscles called the soleus muscle. And we'll have to spend a whole session just talking about soleus muscle because it is a wonder for metabolism. Next is hamstring curls. So get these hamstring curls done. 7 leg extensions. This is one of my favorites. This is one of the ones I did every day when I was dealing with knee pain. This strengthens your quadriceps. You can see when you do this with no weight, you can actually feel your quadriceps. You can feel those tightening and shortening. Straight leg raises. Straight leg raises definitely help patellofemoral pain because you're working, as you can see, your hip and you're keeping that leg straight. You have the other one bent on the ground. Next is side leg raises. This also challenges your knee to stay in place. Patellofemoral pain, it will help that as well along this IT band. The IT band runs from the hip down to your knee. So these are things that you can strengthen doing these every day. And the last one, but not least, is prone leg raises. And so these are stretches. I'll drop the link below that you can do at home to help. But just to recap, so your top 5 things that you want to do that that I do, I don't want to recommend it, but the ones that I recommended to myself, I'll say it like that: minimize stress, food stress, mental stress, anything that would cause inflammation in the body. And that would include, do you have an autoimmune problem going on that you don't know about that's untreated? Check on that. Weight management is number 2. Proper footwear is number 3. Sleep positioning, if you're a side sleeper, keeping that pillow in between your legs, is number 4. Number 5 is exercise, strengthening those muscles above and below the knee joint, not getting rid of your exercise, but encouraging more exercise. Are the 5 things that I think that I did that may help you improve your knee pain. But that's it for today. This is Health Daily. I'm Dr. J. Thank you for joining me. Make sure you like, subscribe, share this video with somebody that you know can use it. As always, I'll see you tomorrow.